This conference will now be recorded.
Status. Good morning, students. Welcome to microbiology class. Today we are going to learn about applied exercises, practicals. This is a poem composed by Daniel Healy. I always got away clean when I went out with the boys. The night before I was married, I went out, but was not so fortunate, and I infected my pride. My little Daniel was born, his eyes discharged, and I dared not tell that because I had seen too much. Little Daniel sees not at all. Have you heard this poem? This is about syphilis. So today we're going to learn about syphilis, applied exercise. Case study. A male patient of age 32 years came with rash over body and history of exposure of painless ulcer over the genitalia. Blood sample collected, serum separated and sent for serological test. So, what is the question about? What are the symptoms? The patient is coming with the presence of painless ulcer over the genitalia as well as presence of rash. So, blood sample has been collected and sent for serological test. So, we have learned that this is syphilis. So, what is the serological test performed for syphilis? VDRL test. First question, what is the serological test? Answer, VDRL test means Venereal Disease Research Laboratory. Next question. What type of a test is VDRL test? VDRL test is a slide flocculation test, which is a standard test for syphilis. So it is a slide flocculation test. Where have you learned about flocculation tests? In precipitation reactions, right? In antigen antibody reactions chapter, you have learned about these tests. Major tests are precipitation reactions and agglutination reactions. And flocculation is a type of precipitation reaction itself. When the particles usually remain as flocules, then it is known as flocculation test. So, VDRL test is a slide flocculation test which is used for the diagnosis of syphilis. VDRL, Venereal Disease Research Laboratory. The test is a slide flocculation test employed in the diagnosis of syphilis. The antigen used in this test is cardiolipin, which is a lipodyl extract from brain heart. So, as a result, it is not a specific test. This test is also classified as non-specific or non-treponemal test or standard test. The antibodies reacting with cardiolipin antibodies have been traditionally termed as. So what is this? Venereal Research Laboratory VRBL test is a slide flocculation test which is used for the diagnosis of syphilis. The antigen which we are using in this test is cardiolipin. which is usually obtained from beef heart. So it is a non-specific test. Next question. What is the antigen used in this test? Right, cardiolipin. Okay, now we are going to learn about what is cardiolipin antigen. What is cardiolipin antigen? It is also known as Calcutta antigen, which is an important component of inner mitochondrial membrane, where it constitutes about 20% of the total lipid composition. It can also be found in the membranes of most bacteria. So, cardiolipin antigen, another name is Calcutta antigen, and it's a part of component of inner mitochondrial membrane. The cardiolipin antigen is an alcoholic solution composed of 0.03% cardiolipin, 0.21% lecithin, and 0.9% cholesterol. So this is the composition of cardiolipin antigen. The most important point to note is the cardiolipin antigen must be freshly constituted each day of the test. In the case of VDRL test, you have to prepare cardiolipin antigen every day, because once you prepare the antigen, it will remain stable only for about 24 hours. Therefore, we have to prepare fresh antigen every day. The working antigen is a buffered saline suspension of cardiolipin. Okay, so what is this cardiolipin? Cardiolipin is the antigen that is used in VDRL test, and it is also known as Calcutta antigen. It is an important component of inner mitochondrial membrane and constitutes about 20% of total lipid composition. This antigen can be found in the membrane of so many bacteria. Then, why this test is known as non-specific test? We are using cardiolipin, right? It is mainly known as non-specific test because it is a lipoidal extract from beef heart. So this antigen is usually extracted from beef heart, but not from Syphilis, Treponema bacteria. That is why it is known as non-specific. Next, composition. What is the composition of cardiolipin antigen? It is an alcoholic solution consisting of about 0.03% of cardiolipin, 0.21% of lecithin, and 0.9% of cholesterol. Principle. What's principle? Patients suffering from syphilis produce antibodies that react with cardiolipin and antigen in the slide population test, which are read using a microscope. It is not known if the antibodies that react with cardiolipin are produced against some lipid component to treponema paradigm or as a result of titre injury following infection. So the principle is that Patients who suffer from syphilis usually produce antibodies, right? When we suffer from an infection or disease, in response to the foreign substance, we usually produce an antigen. However, in this case, the antibodies that are produced usually react with the cardiolipin antigen that is usually extracted from other species. Now, what is this? Suppose if we are suffering with typhoid fever, salmonella antibodies will be produced in our body, right? So, when if you want to do typhoid test, viral test, what are the antigens which we employ? Same salmonella antigens only. But in the case of this syphilis, the antigen that is used is not taken from Treponema pallidum, but it is extracted from beef heart, cardiolipin. That's why this test is called as non-specific test, because the antigen is not taken from the parasite itself, but from others. Process. How will you perform VDRL test? Take patient's serum and inactivate the patient's serum. Okay, so collect patient's blood sample and separate the serum. After taking the serum, you have to inactivate. You can inactivate the serum by heating at 56 degrees centigrade for about 30 minutes in a water bath. Why do we need to inactivate the serum? We need to inactivate to remove non-specific inhibitors such as complement factors. The test can be performed both qualitatively and quantitatively. Those tests that are reactive by qualitative are subjected to quantitative to determine the antibody titers. So, how do we perform the test? Patient's blood is collected, serum is separated. After that, serum has to be inactivated by heating at 56 degrees centigrade for about 30 minutes in a water bath. Okay? When you inactivate it, all non-specific inhibitors will be destroyed. Then you can perform this test. Same like ABO blood grouping. How will you do ABO blood grouping? You will add a drop of antigen and you will add a drop of your blood. Mix it and see if there is agglutination or not. Right? Right. In the case of here, in this test, you will add a drop of patient's serum and next you will add cardiolipin antigen and you will mix it and you will see if there is any flocculation or not. Okay, if there is flocculation, then it is called as positive. If there is no flocculation, then it is known as negative. This is called as qualitative. Qualitative means it only shows whether it is positive or negative. All positive samples have to be retested for quantitative. Quantitative means you have to serially dilute the serum and see at how much titre it is present. Qualitative method. Allow the reagents and samples to reach room temperature. The sensitivity of the test may be reduced at low temperature. Place 50 microliters of the sample, positive control and negative control on each of the slide samples. Sprinkle the VDRL suspension gently before using and add 1 drop of this reagent into separate circle on the glass slide. Mix the drops with different stirring sticks for each sample, spreading them over the entire surface of the or place the slide on mechanical rotator at 160 to 180 rotations per minute for 4 minutes. False positive results could appear if the test is read later than 4 minutes. So what you do this qualitative method? Take a VDRL slide and add a drop of patient's sample and add a drop of antigen. You can also add positive and negative control. Mix it and you have to rotate it. Mechanical rotator is commonly used. You have to rotate at 160 degrees centigrade to 180 degrees centigrade for 4 minutes. Normally 2 minutes to 4 minutes is taken. And you have to read if there is flocculation. If you read the result after more than 4 minutes, false positive can occur. Quantitative. For all the samples which test positive through qualitative, compulsory we have to perform quantitative method. This is performed to determine the antibody titres. The serum is doubly diluted in saline from 1:2 to 1:56 or more. 0.05 ml of each dilution is taken in the well and antigen is added to each dilution and rotated. The results are then checked under a microscope. The highest dilution showing flocculation is considered as reactive titre. If the clinical findings are strongly suggestive of syphilis, the quantitative test may be directly performed on the serum specimen. Interpretation. How will you interpret VDRL test? If negative means finely dispersed particles without any clumping. So there will be no clumping. In weak positive means some clumps will be there, small clumps. A positive reaction is usually indicated by medium to large clumps. Please see this diagram. Non-reactive, weakly reactive, and strong reactive. Only when the clumps are well defined and large, then you can say it as positive. Next, significance of VDRL test. What is the significance of VDRL test? This test becomes positive 1 to 2 weeks after appearance of primary lesion, that is Chancre. And the test becomes reactive in the late phase of primary syphilis and becomes highly reactive in the secondary syphilis, and the reactivity decreases thereafter. So what is this? VDRL test usually becomes positive 1 or 2 weeks after the Chancre appears. So, highest amount of positivity results can be obtained during secondary syphilis stage. Treatment in the early stages of infection may completely suppress the production of antibodies and result in non-reactive tests. Effective treatment in primary or secondary stages result in rapid fall in titre, and the test may turn non-reactive in few months. Since the titre falls with effective treatment, it can be used to assess the prognosis. VDRL test is also useful in the diagnosis of congenital syphilis. Since passively transferred antibodies through placenta may give false reactive test in serum of an infant, a repeat test after a month showing no increase in the titre may rule out congenital syphilis. What are the other tests? One is VDRL test. Another most common test which is used for the diagnosis of syphilis is RPR test. That is a rapid plasma reagent test. What is this RPR test? Rapid plasma reagent test is a blood test used to screen you for syphilis. It works by detecting non-specific antibodies that your body produces while fighting the infection. The test does not look for antibodies against the causative bacteria, but it usually looks for the presence of antibodies such as IgM and IgG antibodies against lipoprotein-like materials released from damaged host cells caused by Treponema pallidum and possibly cardiolipin released from the treponase. These antibodies are traditionally referred to as reagents. So, RCR test usually does not look for the antibodies of the bacteria, but it usually looks for the presence of antibodies such as IgM and IgG from the damaged which have been damaged by the bacteria. Next, made from modified VDRL antigen. In the case of RPR, this antigen is a modified version of VDRL antigen. In this version, it is containing choline chloride to eliminate the need of heat inactivate serum. Usually in VDRL test, we need to inactivate serum, okay, in order to remove complement factors. But for this test, no need to inactivate serum because it also contains some suspensions which usually tackle about those inactivators. The antigen is prepared from modified VDRL antigen suspension containing choline chloride to eliminate the need to heat inactivate serum. Ethylene diamine tetraestic acid to enhance the stability of suspension, and finely divided charcoal particles as a visualizing agent. Another, this finely divided charcoal particles. The antigen is having finely divided charcoal particles, which enables the person to visualize efficiently. Principle. What is the principle of RPR test? What is the principle? RPR test. Rapid plasma reagent tests are macroscopic, non-treponemal flocculation card tests that detect antibodies produced against antigens released by damaged host cells in patients suffering from syphilis. In the test, the RPR antigen is mixed with unheated or heated serum, and the antigen for detection contains cardiolipin less than cholesterol in addition to choline chloride, EDTA, and charcoal particles. If antibodies are present, they usually combine with the lipid particles of the antigen, causing agglutination. The charcoal particle coagglutinate with the antibodies and usually appear as black clumps against the white card. If antibodies are not present, then The test mixture will remain uniformly gray. Method. How will we perform our PR test? Say, take a white card and add a drop of the serum and add a drop of the antigen. Mix it and rotate it continuously for about 8 minutes. And look for the presence of flocculation macroscopically. Interpretation. Presence of characteristic black clumps indicates a positive RPR test. Absence, negative result. Applications. It is used mostly as a screening test for syphilitic infection, combined with specific antibody testing. The RPR test allows confirmatory the diagnosis of active infection and for starting treatment. Screening of syphilis is a routine part of pregnancy tests. The test for syphilis is also performed if being treated for any other sexually transmitted infections such as gonorrhea, HIV, or if engaged in high-risk infections. Advantages of RPR test against VDRL test. These points are most important. First one, easy to perform and fast screening test. Second, results can be observed without the use of microscope. In the case of VDRL test, we need to observe flocculation under the microscope, whereas under RPR test, no need, but RPR antigen usually consists of charcoal particles, which make it more visible to visualize by our normal eye. In addition to screening for syphilis, the titre can track the progress of the disease over time and its response to therapy. Since it is a non-troponymal test, mainly used to indicate syphilis along with other types of troponymal tests such as yaws and next. What is the significant titre? 1:16. If it is 1:16, it is positive. Less than 1:16, negative. Next. What are the other tests for the diagnosis? Two other important tests are Treponema pallidum heme agglutination test, Treponema pallidum immobilization test. What is syphilis? Syphilis is a sexually transmitted infection caused by bacterium Treponema pallidum. So it is a sexually transmitted disease. It is caused by viral bacteria, namely Treponema pallidum. So, what is chancre? In syphilis, chancre is seen. But what actually is chancre? It is a painless genital ulcer formed during the primary stage of syphilis. This infectious lesion will stay for approximately 21 days. You can see this lesion formed 21 days after initial exposure of the lesion. Chancre transmits the sexually transmitted disease through direct physical contact. And these chancre are usually present around the anus, mouth, penis, and vagina of the infected patient. These lesions usually fade away between 4 and 8 weeks without application of any medication. What are the stages of syphilis? We have read this, right? What are the stages? Primary, secondary, latent. Tertiary. Primary. So in primary syphilis, what you see? Primary syphilis is usually characterized by the presence of chancre, and the chancre is usually painless and hard. Secondary syphilis, rash is formed, which is pink to brown macules. Oral lesions may be present. Sometimes symptomatic early neurosyphilis, cranial nerve defects can be present. Ocular diffuse. Latent. What do you mean by latent? It usually refers to asymptomatic infection after the period of primary and secondary syphilis. After a latent period, it goes to tertiary stage, which leads to neurosyphilis. This is the distribution of syphilis in India. That's all. Syphilis. Practical applied class. Thank you once again, students, for coming for this class.